Carolyn 4 is in the ER, again, with yet another episode of projectile vomiting and terrible abdominal pain.
And it's as hard as a rock.
Okay, I know why it's hard as a rock. Because your whole stomach is filled up with stuff.
Oh, it's just...
I'm sorry.
It's just horrible.
Carolyn is talking to Jessica Zitter, a physician who practices at Highland Hospital in Oakland, California. She practices palliative care, a specialty that addresses suffering in patients with serious illness. Over the past year, Carolyn's been in and out of the hospital.
I have pancreatic cancer, and I've had it since 2018.
She's had gastric distress related to both her cancer and the chemotherapy.
Somebody came in here today and said that it could have possibly spread. I don't have any family members with me today, and it just devastated me.
I'm so sorry. How stressful for you.
Oh, I would love to see my husband, but I'm no good to him because I can't walk.
So not only can you not walk, but you're really sick to your stomach. There's much more stuff we can do to make you feel better.
Oh, doctor, thank you so much.
Yeah.
As a palliative care specialist, Jessica's primary focus isn't beating the disease at all costs. Instead, she prioritizes patient comfort. But she actually began her career as a critical care doctor. That's a specialty with a lot of invasive procedures, the kind that keep failing hearts beating and blood pressures from bottoming out. Their primary concern is simply keeping people alive. However, in 2003, a powerful experience took Jessica's career down a different path.
There was a patient who was really, really sick. I remember this patient so well.
At the time, Jessica worked in New Jersey. Everyone knew the patient was close to death, but the medical team still decided to perform dialysis. Jessica was about to insert a large dialysis catheter into the patient's neck when she heard the voice of Pat Murphy, an advanced practice nurse.
She takes her hand and she kind of puts it up to her face like it's a pretend telephone. She says, "Call the police. They're torturing a patient in the ICU." Like, I felt my heart kind of drop down into my stomach. I felt this shame. She's right, but I didn't have a way out of it. I could not imagine how to stop this procedure. It was a horrible moment in my life, and one which made me cross to the other side and change my philosophy of how I wanted to provide medical care.
Even after years of doing this work, Jessica still faces pushback from people holding a common misconception, that palliative care is simply about withholding treatment and letting people die.
It's the exact opposite of what I understand palliative care to be. There's many, many other types of success besides curing your disease. Being able to spend whatever time you have left living at home with support coming into your home to take care of you, getting out of pain.
Jessica often meets patients when they first arrive in the ER, especially if someone shows up with serious symptoms and seems to be approaching the end of life.
That emergency room moment is a really critical juncture. There's a lot of patients where they can either come into the hospital and get put on what I call this end-of-life conveyor belt, where they just go through this protocolized addition of one thing after another, and eventually end up in the intensive care unit, or they can actually go home, because most people have never thought about what they want to do as their disease advances. And it's an opportunity there for us to really get in and talk with people about what's going on and what the options ahead of them are, which are very different pathways.
Jessica initially met her patient, Carolyn 4, in the ER, after which Carolyn was admitted to the hospital for additional testing. It's now clear the chemo didn't work, and after working with the palliative care team, Carolyn's decided to choose hospice, to live at home and have her symptoms managed there. But before Carolyn goes home, Jessica wants to make sure she's as comfortable as possible.
But I just want to tell you we have good news. I spoke with Dr. Lou, and he's going to go back in and look and see why you're so plugged up in there.
Okay, sounds good.
I don't feel comfortable sending you home with your belly that stopped up. How do you feel about that?
I feel wonderful about that. It gives me hope.
Should we call your daughters and tell them?
Carolyn is ready to move on to hospice, but first she needs to tell her husband the cancer treatments didn't work.
And that's going to be the hardest thing in the world.
Jessica is used to seeing patients put off difficult discussions like these.
I have a question for you. Do you think there's any chance that telling your husband positive things might come out of it?
Doctor, I don't think so. He wants me home. He wants me to be sitting on the chairs together and talking and having coffee together, and knowing that I wouldn't be there very much longer. He couldn't handle it.
Let me ask you something. Do you think there's a piece of him that knows?
The way he's talking, I don't know. I don't think so.
With some encouragement from Jessica, Carolyn's finally ready to let her husband know the truth.
Your family's here, yay! And he looks fantastic.
He does.
I would rather know, and if you're protecting me for something, if I don't know what it
There is
is.
something I have to tell you.
I know, there always is.
Yeah.
Yeah.
The chemo didn't work.
I pretty much don't have to be told.
It didn't work, so he's not going to try chemotherapy on me anymore.
I suspected that.
I didn't want to tell you, but I want to tell you now.
No,
What do you think that
suppress it.
means?
Probably there's limitations now.
You're right, Keith.
We both have to adjust to it. And
You're right. I'm not going to suffer.
yeah,
I have hospice. I'm not going to suffer.
How are you feeling right now with this secret that you have been trying so hard to keep from Keith, kind of out in the open?
I just feel so good. It's just wonderful.
A good husband. What a family.
A few months after this conversation, Carolyn peacefully passed away in a hospice care facility with her husband by her side. That story was reported by Noam Osband. The doctor we heard from, Jessica Sitter, has written a book about palliative care. It's called Extreme Measures: Finding a Better Path to the End of Life.